So BonTriage is a project that I began with Alan Rappaport and an artificial intelligence professor named Jim Blythe a number of years ago. And it was intended to address the shortage of headache specialists, basically. So one of the challenges that faces us as headache specialists are that often we see patients who have either been inadequately treated or improperly diagnosed. And we know that we understand this because headache has sort of been a neglected corner of neurology and medicine for a number of reasons. So our idea was to create an instrument that would address this disparity in scale. So that disparity in scale at the moment is 700 headache specialists in the country, in the US, to treat upwards of 40 million people with migraine. Probably 60 or 70 million people if you look at other headache types as well. It takes a long time to get a proper diagnosis, and it's not like an infection where you just culture the fluids and see what antibiotic kills it. Sometimes it's a long path to the right treatment. So our first challenge was to create an instrument online that would work sort of the way we as headache specialists approach headache. And the way we approach it is with what's called a semi-structured interview. We have this set of diagnostic criteria called the International Classification of Headache Disorders, version 3. And we go about a process in our head, largely, of kind of honing in on the right diagnosis by asking specific questions, and then when we kind of pick up something or when we discard something, it kind of guides us on the more direct path. So that could be 20 questions, it could be 500 questions. So we set out to find a way to do that electronically, and through a number of things that I won't pretend to understand, we created an instrument that basically asks questions in much the same way that you would with a semi-structured interview. The most obvious example is the first question is, do you have headache? If you say no, it's a very short questionnaire. A more complex answer would be, do you have trouble sleeping? If you say yes, we might ask a dozen more questions about sleep and the role of sleep and the relationship to your headaches. If they say, no, I sleep well, I wake up refreshed, we probably would not pursue those sleep questions. So someone taking the instrument gets what's called a shortest path analysis. So it's the shortest route you can take to a clinical impression without cutting corners and without asking patients questions that are not really relevant to their story. So one patient may answer 40 questions, another patient may answer several hundred. And then what we did is we tied in the elements within the questionnaire to the diagnostic criteria, so that we do come up with a clinical impression, and we translate that into natural language. So it actually reads like a report from a headache specialist. So instead of being answers to questions, it reads, this is a 38-year-old right-handed Hispanic female whose headaches began with menarche. She presently has yada, yada, yada. So we've been developing that over the years, validating it. It's available for free on the internet. We're not charging for it at this time, although it's getting expensive to maintain the servers and things. But so far, we've self-funded it, and it's been very instructive. A lot of people around the country use it. To kind of save time in their initial evaluation, they can read this report in a minute or two, and then they don't have to ask questions like, what's your sex, what's your age, things that are pretty straightforward. And a lot of people just don't know the questions to ask, but we sort of take care of that. So that was the first thing we developed, and we call it the deep dive. We're trying to find a more academic name for it, but that's basically what it is. Then we discovered that there's another problem. This seemed to really help, but we discovered there's a second problem, and that is, how do we assess in real time the benefits of our diagnosis and our treatment? So we come up with a diagnosis, we recommend a treatment plan, but how do we know if it's working? Because when you ask a patient, they're not sure how many headaches they've had or whether they're better or worse. Sometimes if you've had a headache the last couple of days, you say, this medicine's not working. And if you've been headache free for a few days, you say, oh, it's the best thing ever. So we've developed an app that both reinforces positive behaviors like good sleep hygiene, healthy eating, exercise, tracks triggers to see whether or not somebody says, there's nothing I can do about my headaches, it's just the weather. Well, we can actually find out if that's true, because in your phone, you can actually see whether there's barometric pressure changes. We can look at a variety of factors and actually do predictive modeling to the point where if someone completes the app on a regular basis, we can say, you didn't sleep well last night, and that's a trigger for you. And there's a storm front coming in, and that's a trigger for you. So is red wine, so you might want to skip wine with dinner tonight. We say it a little more efficiently than that, but we can make those kinds of predictive models. We can say, I know you think your headaches are stress related, but using your morning commute, we see that there's really not much stress based on traffic patterns, for example. And perhaps, it has more to do with the cycling of your menstrual period than it does with, stress. And so it can change your strategies. And then more importantly, we can say you were having 14 headache days a month up until you started this new medicine, and now you're having 8 headache days a month. So the medicine's working, or that it's not working. We can send push notifications that say, don't forget to take your preventive tonight. So it's an app that goes way beyond just being an electronic calendar. And that's also available for free presently on both iPhone and Android.